What we have here at the Tooth Bank, to me, is more valuable than gold. The Tooth Bank was opened in 2021 here at the NUS Faculty of Dentistry and the National University Center for Oral Health to develop dental research here in Singapore. It all starts when patients that need tooth extraction comes to the clinics. On that day, we're going to invite the patient to donate the tooth after the extraction for us to bring to the tooth bank and use for research. After the extraction is finished, the tooth goes to a tube. In the end of the day, we're going to collect that tube and clean and disinfect the tooth so it can be brought to the tooth bank for further preparations. We clean and disinfect the tooth on the same day when they are extracted. A clean tooth will last longer in the storage in the tooth bank. In the process of preparing the tooth, we usually use a precision cutter. Sometimes we use even a laser to tell exactly where we want that cut to be done. And each researcher will have different requirements. Some people may prefer a square. Some people may prefer a tooth, but that is flat. Some people will say, well, I just need the root, so I will cut off the crown. So it really depends on the project, but the process is more or less standard, that is reducing the sizes and the dimension of the teeth to fit the purpose of the project. One of the potential applications is to use a flat surface to bond the restoration and see how much force I actually need to have on that surface to remove the restoration. That will be very useful, for instance, if a new material comes to the market or if a researcher is developing a new filling material, so we can know, for instance, if the material can really bond to the tooth structure and not fall off when people are eating. We can also do other types of research like pulp regeneration, when we use stem cells to regenerate the pulp inside the tooth so people don't need to actually undergo root canal treatment. So the tooth bank is actually very important because what we find out using those teeth that were donated for us eventually translates into knowledge, and this knowledge is actually translated to improve the oral health of our community.